Ladies and gentlemen, can you please take your seats? Ladies and gentlemen, esteemed guests and respected participants, good afternoon and a very warm welcome to the public awareness seminar on the prevention of spina bifida and folate fortification. We are gathered here in the auditorium of Northwest School of Medicine for this important session. I'm Dr. Almas Patak, your state secretary for today's session. Let's begin our session with a spiritual touch. We're honored to have Qari Abdul Madani for recitation from the Holy Quran. He is a graduate from Medina University, senior member BUG Khyber Teaching Hospital, Peshawar, senior member BUG Red Crescent Merged Areas, Pakistan, member Central Rural Hilal Committee. He is also a lecturer at Northwest School of Medicine. He will recite few verses from the Holy Quran. Please welcome Qari Abdul Madani.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. هو الله الذي لا إله إلا هو عالم الغيب والشهادة هو الرحمن الرحيم. هو الله الذي لا إله إلا هو الملك القدوس السلام المؤمن المهيمن العزيز الجبار المتكبر سبحان الله سبحان الله عما يشركون. هو الله الخالق البارئ المصور له الأسماء الحسنى يسبح له ما في السماوات والأرض وهو العزيز الحكيم. هو الله الخالق البارئ المصور له الأسماء الحسنى يسبح له ما في السماوات والأرض وهو العزيز الحكيم. صدق الله العظيم.
I kindly request everyone to please rise for the national anthem. I take the seats. Now, I would like to introduce our esteemed lineup of speakers one by one who will share their expertise and insights on the prevention of spina bifida and the importance of folate fortification. First, I would like to invite Professor Sidra Jabbar Khan, FRCOG from UK, and she's consultant obstetrics and gynecology at Northwest General Hospital and Research Center. She'll provide her valuable insights into the prevention of spina bifida from the perspective of obstetrics. Please welcome Professor Sidra Jabbar Khan. Yeah, we have to discuss.
Coming to the treatment, the main thing is that there is no cure for the nerve damage that is caused by the spinal bifida. And since there is no cure for it, so the main stress is on prevention of disease. Because if a patient is born with it, so we have before the birth and the neurosurgeon after the birth, the orthopedic surgeon, physical medicine and rehabilitation physician, neurologist, urologist, ophthalmologist, and so on, depending upon whatever the need of the patient is. So, involvement of different specialties is seen. Now, since we know that there is no treatment once the nerve involvement occurs, so the main focus would be on prevention of the disease. Prevention is with dietary supplementation of folic acid, and this has been shown to be helpful in reducing the incidence of spina bifida. And sources of this folic acid are whole grains, fortified breakfast cereals, dried beans, leafy vegetables, fruits, and of course, folic acid tablet in the tablet form. So much work has been done on this prevention of spina bifida, and we've got so many papers on it where the main stress is on prevention. The main stress of prevention is on folic acid, folate fortification. In Pakistan and other low to middle income countries, while providing the healthcare, the main concern is the finances. Most of the countries, they do not provide full medical care to the patients, and patients themselves are supposed to pay for their medical bills. Very luckily, folic acid tablets are very cheap. They are like a full month supply would cost rupees 30, which would be 10 cents or less than 10 cents. Yeah, just 10 cents of the US dollars. So the whole supply of month would be this much. And if you are going for prevention, if you increase to the TDS dose, so say 30 cents per month. So I mean that is affordable for many of our patients, and this thing starts with the awareness. You need to know that you have to give this to your patients, and the other thing is that the patients are willing to come for the antenatal and especially prenatal checkups. Once the patient has a baby like this, she's always very keen to have good antenatal care for the next pregnancies. So you always, when you get a patient like this, it is not just this patient, but in order to prevent having further babies like this, you need to make her aware that she has to take this medication 3 to 6 months before planning her next pregnancy. So that is the right time to counsel those patients. So this would be one level where we will be counseling the individual patients. But if you're talking about the whole nation and the governments come, and that will be in the form of fortification of our diet, different dietary products. So there is this one article published in Journal of Orthopedics, orthopedic reports. There's the review article, and it says that it is beneficial effects of folic acid fortification in the prevention of spina bifida and reducing the orthopedic procedures. So obviously, when the patient, when a baby doesn't have the spina bifida, so the risk of the orthopedic problems won't be there, and this is again there's another study where food fortification with folic acid for prevention of spina bifida and encephaly. So the conclusion in this is that it is stressed again and again that the dietary products need to be fortified with folic acid. Global update on folic acid preventable spina bifida and NMKF. We have the Journal which is the Journal of Pediatrics. And you can see that. Here you can see the line from the on that side line. The number of cases were quite high, but once the folate fortification was started, so the numbers have reduced down. All the occulta, the meningovirus, all cases have come down. So once the folate fortification was done. This is for the child and the folic acid supplementation that we discussed, that sort of a thing. And whatever studies you pick out for the spina bifida, the main stress is on prevention. Prevention is the main goal where we focus, and this would be by providing good antenatal care. But of course, for that they have to have awareness regarding these problems and many other problems that they can have during pregnancy. For that, we need further research, we need further education, and we need further training of our budding doctors who will be just like you sitting at the back. So you need to be getting information and education about these problems so that you can spread it in your community. Then again, another study where it is shown that spina bifida associated infant neonatal mortality and case fatality was declined when this mandatory folic acid food fortification was done. In Pakistan, we have some steps have been taken, and of those 447 mills they are producing fortified flour. So they are in different parts of the country, but this is very little of what we should be doing, especially in our country. So wheat flour fortification project is there. This is in Pakistan, and this is one of the chakiata, which is fortified. And then besides this, the foods rich in folic acid need to be conveyed to the patients and to the general public as such, where the beans, the peanuts, the sunflower seeds, and all these things are there. Folic acid supplementation, just as we discussed, that this is very doable even in our setups, and this should be done. So that's all about this very important topic. If there are any questions, I'll take that. Thank you. We'll have a question answer session at the end. So if you have any questions, you can ask that at the end. Next, to discuss the health initiatives undertaken by the government of Sindh, which is the second largest province of Pakistan, to address hydrocephalus and spina bifida. Please welcome Assistant Professor of Neurosurgery from Pelawan Medical College and the focal person of Sindh government, Dr. Peer Asad Aziz.
So, health initiatives from the government of Sindh regarding hydrocephalus and spina bifida. So, how it started, the background was when COVID occurred, all the facilities were blocked. People of the province, and as we know that the spina bifida, most of the time it occurs in Sindh, there is a desert, Thar, and Thar is very difficult. It's very difficult for the people of Thar to reach to the main cities. I work in Hyderabad, around 200, 280, 300 kilometers from that region. Thar. So in COVID, transport were blocked. We neurosurgeons are already short in every part of the world. People were facing many difficulties. So we decided that at that time to conduct an outreach surgical program. That was first of its kind in the whole country, because usually the outreach program are of medical kind. We decided to conduct a surgical program, and we went there in Sir. We found a hospital, private hospital. We discussed with them and we said them that we will do surgery freely. You should help us in the regard that we should provide logistics. So, sorry. So what we did, we conducted the program, and that was the first outreach surgical program. And in that, so this was of Mithi. Mithi is the third area. So we did in that region. And afterwards it continued in the when the COVID was ended, and then what happened? Flood came in the Sindh area, and it was very difficult again for the people to come. So we conducted this program with a team of volunteers, and we found these all the pictures. What I'm showing are of these outreach programs. So on this baby, for example, with huge lipomyelin, and this baby, for example, had a enlarged head. She was around 14, 15 years, and she was unable to walk. They bring them in a jeep. She was lying, and she saw the baby there, and she was surviving. So, with the help of volunteers, team of radiologists, anesthetists, paramedical staffs, all from the Hyderabad, we went there and we started. So we conducted scrutiny, got some donations from family, friends to perform these activities. Till then, we performed 19 camps and performed 45 free surgeries at our own, which we saw around 1875 patients in 10 districts. Then I took those initiatives and then to the government of Sindh. But before that, when I was conducting the first surgical camp in the third area, I was amazed because the number of patients with hydrocephalus spina bifida, out of 140 total patients, around 64% of patients, means 90 patients came with hydrocephalus spina bifida. I've never seen that much in our city. So I was so much amazed in this this Mithi region. So we conducted camps in other regions and we saw patients. But what was the target at that time? Seeing that much number of patients, we always focused on hydrocephalus spina bifida. Along with them, if the patients with any other neurological disease come, we used to see them as well. So with these ratios and reports, the 8.5% of patients from these 1875 were hydro. But if we see in that Mithi first came, it was of 64% patients. So what we did, we conducted different surgeries and in different regions in that, along with hydrocephalus and spina bifida, we conducted other surgeries as well in different regions in these outreach camps. These were few glimpses of those camps and pre-op assessments and pictures of few surgeries. What problems during those period I faced was financial support, logistic, manpower was lacking. Those people who were there were not trained. Coming back to my city, then we started because of so much number of the patients, we started campaign. So we started first time a seminar in our own university to teach our doctors, paramedics, every kind of people in the hospital. And on 25th October, as there is a World Day, so we did on that day. Afterwards, I went to the government of Sindh to ask them for help. They helped me. I conducted a first program with their help in 2022. So what we were targeting, because there was lack of education, poverty, people don't know how to come to the hospital. So we put those figures, hydrocephalus spina bifida, in a backward area, one can see these patients and they can bring them to the hospital. So meeting with the health minister, then with interim health minister, they helped. We formed a chart how to conduct a successful event. In those, we pointed out, listed all the things which we require from the government and what initiatives, how can we take. Then again, awareness is the main stay, I think, and we were doing campaigns, and not only in big areas but in every hospital. What we did, me along with my team of volunteer friends, I used to say them, go to one hospital, I'm going to another hospital. So we covered nearly all hospitals. So in different hospitals we did. Then we use media platforms, and this person was the Director General Health, the highest government official of the government. So I asked him to give message regarding folic acid awareness and prevention for these spina bifida. I went myself on radios, TVs, used print media to give awareness, among like students and everybody. We conducted webinars as well. So in webinars, not only this, we involved gynecologist, medicine doctor, radiologist, pediatrician, epidemiologist, all on a channel, so that they can give their views. Again, with the help of government, we conducted the same camps like this way. During those camps, we involved director health and medical superintendents to help us with us. Volunteer students were us together with us. We sent them, taught them. Already they went in the society, and then what they did, they were filling the forms about their awareness, then teaching them. This was a performa in which not only biodata, antenatal care, family history, previous cases like this, all were included. So these are a picture from them. The consent form was taken that we will publish it, but we explained them in local language, Sindhi. So screening was done, and with not only hydrocephalus, spina bifida, as I mentioned, different kind of other diseases were also in the camps. So this was one of the case that came in Mithi, third region, with collaboration of government of Sindh. That was so huge, and the baby was 3 years. The biggest city of Pakistan is Karachi. In public sector hospital, she was deferred that if we will do, baby can die. So parents took her back, and they decided that it's up to nature, whatever will happen. Because of this camp and poverty, NGO people, NGO person took the baby to us, and we, because it was high risk, so we took the patient to the city. But before it, I again went to government of Sindh, and I asked help from them to give us rescue 1122 vehicles, along with them pediatric ventilators, anesthesia machines, to conduct those in the government sector hospital cases which I can perform over there. So we conducted spina bifida cases, encephalocele in those regions, third region, but this patient was taken back to the Hyderabad because of its complications. And Alhamdulillah, we operated. That was so huge. It was of 9 kg, and the baby was overall 15 kg, and around 5 liters of fluid was there inside it. So this was the baby greeting on Eid, last Eid. These were the few beneficiaries of those camps, which outreach health initiatives which we were conducting with the government. Along with this, the bill from the Sindh government is already passed in 2021 regarding foliate fortification. So hopefully this would be, as the previous speaker told us, that there are few areas where the meals are floor and meal are being made with fortification. But hopefully now, inshallah, with this government, it will be all. And this was published in Nutritional International. What future prospects we see? We see that formation of spina bifida hydrocephalus society, journal, annual camps should be done in like those areas, pseudo-endemic areas. And we are conducting them. We are conducting collaboration with government of Sindh for our financial support, where we can do these camps. And I think Professor Tariq Khan is there, and he is a senior person in the Pakistan Society of Neurosurgery. So we should involve young neurosurgeons, because young neurosurgeons are capable of doing these. If they cannot do every kind of surgery, but these case surgeries, they are trained it for them, so they can do it in different areas. So what young neurosurgeons should be taken on board, and they should be charged that you should go and perform these kind of things in different areas, difficult areas. If you find a complicated case, bring them back to the city. And the gap should be decreased. By this way, neurosurgeons and disease burden, the gap between these should be decreased in this manner, because someone has to go there and do these things. And everyone should take his or her initiative and go there. This was my team, and in them, those participated in different surgeries and all, and few of them are now consultants and few are PGs, different radiologists. Thank you. Jazakallah.
Thank you, Dr. P. Asad for your experience from Sindh. It is with great honor and deep respect that I invite Imdadullah, the parent of a child with spina bifida, to join us on stage. He will be sharing his personal journey and experiences, providing a unique and insightful perspective on living with a spina bifida child. Let's warmly welcome him as he graces us with his presence.
In the name of Almighty Allah, who is entirely merciful and entirely compassionate, I am proud of each and every one of you to be here today at Northeast School of Medicine. First of all, I want to thank to the professor of Northeast General Hospital. One of my brothers, he got married to his cousin a year ago. May Allah bless him with an angel. The baby was born through a C-section at a local hospital. The doctor told us that there was a swelling on the baby's back. Hearing this news, we became very worried, and all our family members were upset. We all started thinking that maybe the baby wouldn't survive. The doctor advised us to take the baby to the tertiary care hospital for proper management. In the tertiary hospital, the doctor gave us a month time. During this time, the problem on the baby's back got worse. Swelling was increasing and people started talking about it. Some say this baby is so delicate and might not survive the operation, or her legs might become weak. With this dilemma, we went for a checkup with the doctor. After the checkup, the doctor informed us in detail about the disease and its treatment. Finally, we decided to operate. During the operation, the baby's mother was crying, fearing that our baby might not make it, and she also fell into the depression and anxiety. After the operation, when the baby was shipped to the nursery, she was fine, was moving all the limbs. We were happy, and there 3 days later, we were discharged from the hospital. All our family members were very relieved. Now his daughter is 6 months old, and alhamdulillah, she is completely fine. There are no weakness or problems. We regularly take her and her mother for checkup to make sure there are no issues in the future. From this event, he and his wife and my whole family came to know about spina bifida. Spina bifida is a disease that occurs babies during pregnancy. It is caused by the deficiency of certain vitamins. If this vitamins is low in the mother blood, the disease affects the baby. That's why it's a duty of everyone to make sure to get their pregnant wife treated by a specialized doctor, so that no one else go through the pain that his little angel, he and his wife, gone through. Thank you so much.
Thank you. Ladies and gentlemen, I'm delighted to invite a distinguished advocate and a leader in the field. She has been at the forefront of efforts in spina bifida awareness Her contributions have significantly impacted the global conversation on spina bifida. She is a professor of neurosurgery at George Washington University, USA. She is chair of G4 Alliance. Please join me in welcoming Professor Gail Russo.
I think of no greater advocacy than that of a family member who's teaching us all how important folic acid intake is. I'm honored to follow that individual. What an honor and pleasure to be here with all of you today. And thank you again to my dear friend, Terry Khan, for the opportunity to be here with you. Tarek had asked me to speak about this topic in the broader sense of where it fits into the global public health approach that this entire first ever global neurosurgery conference is about. So I decided to take a page out of Harvard Business School, which looks at case studies and what principles from individual cases or situations we can use to learn about the next thing we might face going forward. So I'm going to speak about this group called the Global Alliance for the Prevention of Spina Bifida, APP, as an example, a case study in how to approach a neurosurgical global health problem. And I'm resting on the shoulders of many other people when I say that I'm speaking for a consortium of some 200 people now who meet every 2 weeks and are moving the ball forward. But a little background for why this is pertinent to our larger conversation about global neurosurgery, that we were very strategic in choosing this this is their particular responsibility, that it would be necessary to have a public health commitment to folic acid fortification. And we wrote this paper together and then started strategizing about how we could make a difference in the world. So the paper was written, a Lancet review of the 30 years of class 1 evidence was published. and Gatsby was formed. Well, why neurosurgeons should be at the forefront of this problem? Well, we argue that we have a unique vantage point on the scope of suffering that we've just heard about, that families encounter when they have a family member with this condition. It's a neurological illness. There are a number of other issues related to it that are urologic and orthopedic that lend themselves to neurosurgeons leading the way, but creating a community. And we provide care across the lifespan, which of course these patients need. There's rehabilitation and other psychosocial aspects to this condition. We also studied the neurosurgery workforce, and because these patients are unfortunate and require often multiple operations over a lifetime, that in some pediatric neurosurgical practices, as much as 30% of the pediatric neurosurgeon's time was spent taking care of just this one condition. We know that there needs to be an increased role for neurosurgeons in the global public health. And we argue too that neurosurgeons have some unique qualities of energy, grit, and perseverance that were set to be the first to tackle an issue like this. And then we were coming into the pandemic where there was a lot of talk about vaccines and how important prevention was. And we've all just been through COVID and the benefits of vaccines to reducing the morbidity and mortality of that condition. But if you look at cost effectiveness, folic acid fortification is much more cost effective than even the proven benefits of a vaccine. So fortification for every dollar spent saves a country $27 and the healthcare costs and lost productivity. So we started to refer to folic acid fortification in the general diet as a quote unquote vaccine to be able to prevent spina bifida. And it was a lost opportunity, just like not having a vaccine for COVID was a lost opportunity, and why it mobilized our pharma industry so rapidly, because it could be seen to be so beneficial. So there was all this preventable disease, and yet we had 30 years of class 1 data that showed that we had a readily available solution. So Gapsmith was started and wrote papers and monographs that brought this problem to the attention of other medical and surgical disciplines. Then we saw, and this was key, we started to seek the support of other collaborators, other stakeholders who were not in the medical community. So these would be people who were nutritionists and millers, for example. So creating a very broad tent for this initiative. So we had collegial stakeholders, we created a nurturing environment so that physicians and non-physicians were working in equity and mutual respect together. And then we built on the broad spectrum of people who were part of this coalition to actually write a resolution for the World Health Organization so that every country would have the opportunity to get involved. And finally, we looked at very large nonprofits like the Rotary Club International for help with this. So one of the products that we produced for people who were part of this growing effort of Big Ten was a slide deck so that we could have socialization of the knowledge that you've gotten today that was shared with every specialty and with the general public. I won't go through all those slides, but then we had opportunities for people to have access to informatics and to these kind of scanning rubrics so that it was easy to get access to information. Just a couple more slides that were in the slide deck. We worked with groups like PUSH that had already started to characterize the levels of spina bifida in every country around the world. And then we finally started to gather support for this resolution. And someone who's going to follow me next here, Kemal Gatmi, was very important, pediatric neurosurgeon, PhD in translational medicine. And Kemal really was able to break into the Ministry of Health of his own country of Colombia, which became the first nation to champion this resolution at the World Health Assembly, bringing on several others and leading to the passage of the resolution in May of last year. And he'll tell you more about it and about the way that coalition was built. So why do we talk about that specific issue? It's important. It involves up to 300,000 births of infants with spina bifida every year, but that's nowhere near the huge numbers, the tens of millions of traumatic brain injuries, for example, for which we're also responsible. I'm coming back here in the conclusion to those things those initiatives that the global neurosurgery community activated early on. The WHO Liaison Committee, chaired by Walt Johnson, the Global Neurosurgery Committee, chaired by Tarek Khan, and the G4 Alliance, which is the home for global surgery, and this International Society of Pediatric Neurosurgeons that formed a network that was a broad group of stakeholders who were able to make change happen. So we have great energy that has been sustained and have built a practical knowledge base since 2015, when the resolution strengthening emergency and essential surgery was adopted by the WHO. We now have an opportunity to embrace this new progress, which up to this point in time, we had not had efficacy of efforts in the public health domain of neurosurgeons, but we do now. We also, in this process, through this case study, if you will, have built relationships with other surgical disciplines, with other non-medical stakeholders, with multilateral organizations, and with governments, which will serve us well. You know, early on, when the WHO Liaison Committee was created, colleagues in neurosurgery would say, you go to Geneva and tell them we need to have a CAT scanner in every district hospital. And that's not the way things work exactly. You need to build consensus and work in coalitions. And so we understand the process better so we can make it work better for our patients. Neurosurgery has a large burden of global disease, TBI, stroke, degenerative spine, etc. We've got a lot of work to do. Our domain is responsible for a lot of the ills in public health. And so therefore, I think we need to actively and creatively expand our workforce and then enhance our workforce's capacity to guide healthcare strengthening. We need to champion expert solutions to public health conditions that are in our domain. Just like if we were at Harvard Business School and we were tackling a product or a problem, we've now got one example of how this can be done. And Kemal's going to tell us next about what the implementation phase of this project is about. Thank you very much for your time.
Thank you, Professor Russo, for that wonderful experience. Next, I would like to invite Professor Kevin Hoffman. He's Associate Professor at the University of La Sabana in Colombia, South America. He'll be sharing his insights into the importance of folate fortification in the prevention of spina bifida. Please welcome Professor Kevin Hoffman.
Bismillahirrahmanirrahim. Assalamu alaikum. Good afternoon, everyone, and it's a pleasure to be here. Thank you, Dr. Khan, for the honor to be in this beautiful country, exchanging knowledge about how to prevent spinal bifida and neural tube defects. This is our agenda for today. We're gonna discuss the steps that led us to the first resolution to prevent neural tube defects in a large-scale policy. and what are the next steps to achieve that. I want to tell you Francisco's story. He is a baby boy born in Colombia with a large myelomeningocele in the lumbar region. Nowadays, we can operate this in the fetal stage when the patients go or present in a timely fashion. It was not the case of Francisco's mom because she arrived very late in the third trimester. So he was not a candidate for in utero correction of the myelomeningocele. So he went to a successful surgery in the 24 hours after birth, and it was a successful closure. But even though this was an impeccable surgery, he will face many problems throughout his life. He can have hydrocephalus, Chiari malformation, scoliosis, kyphosis, tethered cord, limb deformities, neurogenic bladder or bowel, and walking disabilities. And he will go to the hospital many times for multiple interventions due to complications or new problems related to his condition. And as Dr. Jabbar masterfully explained, he will also face throughout his life many psychosocial problems like being dependent on others for the basic functions or having a long-term disability. In the world, 3 of every 1,000 babies are born with a neural tube defects, and that goes from spina bifida occulta to anencephaly or craniorachis cases, which are lethal conditions. But that's just the tip of the iceberg. As you can see here, the living birds are almost 186,000 babies per year worldwide. But we know that there are many more cases because misclassified neonatal deaths are attributed to a neural tube defect. Stillbirths, 30 to almost 80,000 per year. In many countries, when a family or a woman realizes that their baby has a neural tube defect, they opt for elective termination. Only in Europe, 16,000 pregnancies are terminated due to the diagnosis of spina bifida or another neural tube defect. And also early fetal losses, which are undetermined or they are attributed to other causes. So as you can see here, the dimension of the problem is enormous. The good news is that neural tube defects are preventable, and we can use diet diversification and the individual level. In the clinical practice level, we can use folic acid supplementation, and in the public health level, we can use large-scale food fortification. These are not mutually exclusive interventions. Quite the opposite. They are complementary, and we should continue working on the 3 levels of strategies for prevention. But only mandatory food fortification is the most effective public health intervention, and we've known that for more than 3 decades. It is practical because it improves the folate levels in women of reproductive age without needing a consumer behavior change. They don't have to start taking pills without having conditions, so we don't need that cultural change. It just improves the levels only by getting it in the food. It is safe because there are no risks associated to the concentrations that we use for food fortification. It is feasible because countries already have the infrastructure for the milling industry or the food industry, so they don't have to make great investments in facilities or infrastructure. They just have to add the premix with micronutrients to the food product. And it is cost effective because fortifying 1 metric ton of flour, for example, costs $6. So it's very inexpensive, but it saves millions in resources and thousands of lives. And it's multi-purpose because it not only prevents spina bifida, it can also prevent cleft lip and palate, congenital heart defects, several types of anemia in the adult population, increasing the productivity of a society, and certain types of dementia in the elderly. And even more, it has social impact because it addresses and helps countries to achieve at least 3 sustainable development goals, such as zero hunger, because micronutrient deficiencies is considered a hidden hunger, improve health and well-being, and also reducing inequities. Or don't you think that being born with a long-term disability is inequitable when this could have been prevented. The good news is that in the world, almost 62,000 babies are protected from being born with a neural tooth defect. The bad news is that it's less than a quarter that we could prevent. And why is that? Because in the world, only 92 countries, less than a half,
fortification standards.
And one of our research led to this finding. What were the barriers and facilitators for food fortification? The main barrier is that policymakers, those who make the decisions, simply do not know. They don't know that this is a public health problem, and they don't know that it's in their hands to take action to change this. And what were the facilitators? Very important. Partnership between academia, universities, and the public sector, and also the role of neurosurgeons as leaders and advocates to translate this knowledge to policymakers. So we designed a knowledge transfer toolkit to close that gap. It's called the Neuro Advocacy Toolkit, and it was designed for knowledge brokers, which is neurosurgeons, to talk to their policymakers in their own countries to convey this message in a digestible way so that they can understand it and take action with it. The core components were a pitch deck, an infographic fact sheet, an evidence brief, and an executive summary of successful legislation. But it's not only the material, also the strategy on how to convey that, making an effective pitch presentation. So this was introduced to key opinion leaders in Latin America, 20 countries, with participation of 100% of the neurosurgical societies. And we selected 30 opinion leaders that were experts, leaders, advocates, and with lobbying abilities to present this to their ministers of health. And of course, I started with my own country, Colombia, in South America. And the Ministry of Health already started a process to update the current legislation and to cover and scale up the fortification of staple food. But then, after the birth of GAPSP, with Dr. Gail Rousseau, who also happened to be part of my doctoral dissertation committee, we came with the idea of taking this to the next level. And since Colombia was a member state of the executive board of WHO, it was sponsored and presented to the 194 member states. We provide scientific advice to the Colombian Ministry of Health and Foreign Affairs, and jointly design a diplomatic roadmap to navigate this course to get to a WHO resolution. We also got consultations with WHO officers, especially to protect the vulnerable peoples, the vulnerable stakeholders of the process, and also to refine the language. And it ended up not covering only folic acid, but all micronutrients and preventing many conditions that are preventable by correcting micronutrient deficiencies. We walk the talk. Dr. Walt Johnson, present here, was also part of this initiative, Dr. Rick Booth, and during the World Health Assembly, there is an event called Walk the Talk, in which you can actually walk and speak with every important stakeholder of the world that can make decisions for it. We navigated with the diplomatic roadmap that was designed, and we also got civil society support with an endorsement letter signed by more than 80 multinational organizations. So it initially went to the executive board, and it was approved without objections in February as an executive board decision to be voted by the assembly at large. And then after 4 years of hard work, we were granted 1 minute to speak before the ministers of 194 countries, which are member states of the WHO. And this is the minute in which we had the opportunity to address the distinguished delegates. The WFNS is to support EB Decision 15238 to accelerate efforts for preventing micronutrient deficiencies and congenital malformations through safe and effective food fortification led by Colombia and other 35 member states. Micronutrient deficiencies drastically diminish individual survival, health, and quality of life, and impact families and society unfavorably. Food fortification with micronutrients, the most effective, safe, and inexpensive preventative intervention, is readily available and requires simple technology. Still, many countries fail to implement this evidence-based policy adequately. The cost of inaction is profound and disproportionately affects vulnerable populations worldwide. We are fully committed to supporting large-scale food fortification policies, implementation, scaling up, surveillance, and long-term sustainability. This resolution will assist member states in reaching the Sustainable Development Goals by decreasing morbidity and mortality, preventing hidden hunger, and promoting health equity. We urge this Assembly to approve it and help thousands of children to start healthy and fulfilled lives. Thank you. Thanks. So after that, all member states provided statements in support of the resolution. There were no objections. And can we go back to the slides, please? And this is the exact moment when the Assembly at large was voting the resolution.
We will now look at the draft resolution titled Accelerating Activities to Put an End to Reduce Micronutrient Shortages and Their Shortfalls, which includes spina bifida and other effects on the neural tube via proper enrichment of food, as recommended by the EB in its decision EB 152-13, which is in document 152/2023/Rec/1. Is the committee in a position to approve the draft resolution in decision 152/13? Seeing no objections, the resolution is approved.
So, I'm pleased to give you the first neurosurgery-led resolution that the World Health Assembly approves. And the good thing about this is not the WHO imposing countries to adopt food fortification policies, is that the 194 countries decided that this is something that needs to be done, and they will have to present reports every 2 years to the Director General on what are the progress that they have made with this policy. The anticipated impact, as Dr. Rousseau mentioned, is that it will prevent at least 200,000 living birds with neural tube defects, and it will prevent also at least 16,000 pregnancy terminations per year. It will improve the population's health and well-being and will allow reorienting resources and efforts. A recent study showed that 30% or more of the activity that pediatric neurosurgeons do worldwide are dedicated to neural tube defects and their complications. So if we can prevent them, or at least most of them, we can reorient efforts to treat not so preventable conditions. I want to show you the case of Ethiopia, a country with almost 120 million inhabitants that has 40,000 children with neural tube defects per year. 20,000 just die because they have lethal conditions. Of the 20,000 surviving, 10,000 of them have spina bifida, and most of them are also left untreated or die because of complications without having a surgical management. The neurosurgeons in the 8 major centers in Ethiopia just simply cannot treat all of the cases, and they usually get very late. And despite significant efforts from the government and non-governmental organizations such as REACH and others, still they cannot manage all the cases. So due to all of this work that we have done with different stakeholders and ministers of health, we had the opportunity to meet and have a long meeting with the Minister of Health of Ethiopia, who happens to be a gynecologist herself. And she and her team understood this immediately, and this was the final impulse they needed because they were working in different initiatives to implement food fortification, but they just needed this impulse to promulgate a law that was promulgated at the end of 2022, and in 2023 they started to implement it, and the mathematical models estimate that they will have 8,000 cases less per year. So from the 2,000 cases, now they are able to treat them in the 8 tertiary care hospitals that they have in Ethiopia. So this shows the dimension of this preventative measure. So what's next? Having the resolution is not the end of the process, it's just the beginning. Now we need to work in these 8 steps that you can see here: education, fortification and monitoring, promotion and prevention, collaboration with civil society and scientific community, surveillance, screening and treatment, financing, and periodic reporting. And from civil society and GAPSB and G4 Alliance, and all of the members that were working on making the resolution a reality will continue working and supporting the countries to achieve that. For the needs assessment, we also designed methodology that includes a scale to see what's the regulatory status of each country regarding food fortification. And it includes the prevalence of neurotube defects, the coverage of the current fortification regulation, the standards, the daily intake, and the percentage of industrialized product in that country. And that allowed us to establish priorities. And this is the scale. It's a 15-point scale, not a surprise that a neurosurgeon will come out with a 15-point scale. And that gives us 4 levels of priority. And you can see in this table, this is for Latin America, the 20 Latin American countries. Those in red have an urgent priority to start changing their legislation for food fortification. And there's high priority, medium priority, and no need for legislation change. Let me show you some examples. So Costa Rica is a champion in food fortification and has been for more than 2 decades, and they have the lowest prevalence of neural tube defects in the world. It's a low and middle income country that has the lowest rate in the world. They have 4.8 per 10,000 births, and that's the ideal. Every country should have less than 5, or at least around 5 cases per 10,000 living births. And why is that? Because they fortify everything. They fortify wheat flour, corn products, rice, dairy products, oil, salt, sugar. They fortify everything, and they include folic acid in all of their staple food. And they have the lowest rate in the world. But if we go to Guatemala, that has the highest prevalence in our continent, is almost 28 per 10,000 living births. They have a very limited legislation for food fortification, and even though they include folic acid in wheat flour, most of the people does not eat that, and the concentration that they use is below the standard recommended by the WHO. So they have a high need, a high priority to change their legislation and to actually protect their population from this preventable condition. Whereas Argentina, they have legislation for wheat flour, and they do not eat too much corn or rice, so they don't need to change their legislation, but they need to use other strategies that we can also provide scientific advice to do that. In my own country, Colombia, we have a high priority because they eat corn and rice as much or more than wheat flour. So we need to actually address the product that the people is really eating. And that's one of the beautiful things of the resolution as well, that each country, according to the context, cultural aspects of local gastronomy and social anthropological aspects, will decide which are the best vehicles to fortify. And I did the exercise with Pakistan as well. So the reported prevalence of neural tube defects is 32 per 10,000 living births, which is highest than the highest prevalence in the Latin American countries. And investigating what is the most consumed products, I found that the consumption of wheat flour is 256 grams per capita per day of wheat flour products such as bread and naan and others. Rice, not so much, is 38, and corn flour is 28. So As happened in the Sindh province, there is a large room of opportunity to protect thousands of children from being born with this condition. And coalitions and collaboration among all stakeholders can be very successful for that, as it happened in other countries championing food fortification. So there are ongoing activities in Ethiopia, India, Turkey, the Philippines, Mexico, Nicaragua, the Portuguese-speaking African countries, and as we learned today, also in Pakistan, they're going to be a leadership taking this to the next level. How do we approach them? We use a top-down and bottom-up approach. What does it mean? For the bottom-up approach, we address the mid-level officers, technical officers from the Ministries of Health, Finances, Agriculture, the policymakers' assistants and lawmakers' assistants, and at the leadership level, we actually can address the government, policymakers, and lawmakers. And there is a preeminent figure here, which are the gatekeepers. They are important to give us that opportunity to open that window to actually put this item in the agenda of those decision makers. And we use science diplomacy because we need to continue working in a global arena for this. And we continue using diplomatic roadmaps through the WHO, WFNS liaison committee. We can also approach and help countries to progress in the resolution implementation, and then help them to make their reports every 2 years. We continue engaging stakeholders, so for example, policymakers in each country need to promulgate the laws and also not repeal those legislations that are positive for food fortification. The food industry are actually fortifying the product according to the legislation, and by indicating that in the product that the fortification is happening, consumers being aware of Noor-ul-Huda defects and that they have to consume fortified products, and healthcare providers with increasing awareness and steadily supporting and promoting food fortification. And then great news is that the meat industry themselves, even though in some of the countries don't have mandatory fortification, they decided to fortify the products, and they started a pilot project including 8 countries. They're going to start with Bangladesh, Ethiopia, India, Indonesia, Kenya, Nigeria, Pakistan, and Tanzania. So the milling industry, even if there isn't a law in the province or a country law saying that fortifying is mandatory, they decided to fortify their products because they realized that it's very inexpensive and it's their social responsibility to improve the population's health. So we continue working in the global arena with all of the possible stakeholders, and we actually have ongoing conversations with the World Bank to finance, especially low and middle income countries, to implement the policy. Fortifying itself is not expensive, but the resources are needed for implementation and for registries and surveillance, and to measure the health outcomes of this facility. So as closing remarks, advocating for primary prevention by no means implies that we're gonna stop the care that we provide to individuals already living with Noor-ul-Huda defects. They need quality, humane, and person-centered care, and we will continue providing that. Quite the opposite, individuals like Francisco or like Imdadullah, that we knew his story today, inspire us to expand the horizons for innovative way of incorporating meaning to our careers. And the ultimate goal is saving thousands of children from being born with a devastating but preventable condition by promoting a healthy and fulfilling start of their lives. I want to thank you, and I'm also happy to answer any question. And thank you so much. I want to thank all of the individuals and organizations shown in the slide. And also want to thank the audience in Neurosurgical TV, thanks to John Bennett, that are showing this presentation through streaming the whole panel, and that will also help us continue the coalescence of multiple actors that will make this a reality. Thanks again.
Thank you, Professor Hoffman. That was a wonderful presentation. Do we have any questions from the audience? Do we have questions online from the neurosurgery TV?
Thank you. There's one question from said we live streaming this morning as well. We live streaming again thanks to the surgery TV to unveil and the question, I don't know if you can answer it or not. So, on Arun Rashid Khatri, who has done a thesis on the same topic, study conducted in our setup in a renowned government hospital, comparable folate levels in the affected mothers and controls. Does it mean there are some other factors causing pulmonary in the hospital and it isn't caused by folic acid deficiency?
So yes, indeed, 80% of the neural cases are attributable to folic acid deficiency or insufficiency. However, there is still 20% that is not folic acid sensitive because it's not caused by folic acid deficiency or insufficiency. So for those cases, we have other risk factors such as exposure to radiation, gestational diabetes, exposure to agrochemicals, and genetic factors, and also very less through environment factors. And also some medication, for example, anti-seizure drugs, that if they are not taken into account during pregnancy, they should be changed or suspended because they are teratogenetic, and one of the main conditions that they cause defects, for example, thyroid acid. So we need to continue working in detecting and studying all of those causes and also having strategies to prevent them as well. But still, there are some cases that we won't be able to prevent. But since we are preventing the majority, now we can reorient our efforts and resources to better research, better surgical care, and better post-surgical care and rehab of these patients. The human resource and the financial resource can be now reoriented. And that's one of the importance of this book.
To conclude the seminar with his closing remarks, I would like to invite Professor Tariq Khan on stage, please.
Thank you, Mr. Madri. I must thank all the speakers here today, this evening, for their real enlightening talks on public awareness. This plan has been going on for a couple of years now, and we've been requesting that we're going to do this session. In the meantime, we made this Global Surgery Directorate in the Northwest School of Medicine. And the first project which we are going to start working on, some we've already done with this particular project, we've already found international collaborators, and we found assets from Sindh government as well. So we're going to combine all these efforts and push for folate fortification, as you said, through a combined effort, and use top to bottom and bottom to up approach to try and make sure that our babies born can be prevented by spinal bifida by folate fortification. Thank you so much. Thank you, everybody.
I extend our gratitude to each speaker for their valuable contributions and to all of you for being part of this important seminar today. Let us take the knowledge gained today and actively contribute to creating a more informed and supportive community. Thank you, and let us make a collective commitment to the prevention of spinal bifida awareness and education. I would like to request all the international guests to please come forward for a group photo on the stage, along with the speakers, of course. Please join us for a cup of tea outside.
जा यार चाय पिया परसेंट